everybody, welcome to pregnancyexercise.co.nz and our Fit Mums channel here on YouTube. I'm Lorraine, owner and pre and postnatal exercise trainer for more than 25 years. Today's video, I know I've gone through this before on Facebook Lives, but I've not put a post like this on YouTube and onto our video for a long time. How to activate your essential core muscles pre and postnatal. Now, if you cannot contract these muscles correctly, it can lead to a myriad of issues. Basically, it can start at the very basic level: poor posture, poor digestive function, increased discomfort during your pregnancy. It can increase back and hip pain. It can increase pelvic floor muscle issues. It can prevent you from getting your mummy tummy back to where you feel happy with it and your core strength postnatal. So it's super, super important. And really, honestly, based on my experience, there are not many of us, and those of you who have not done our programs, of course, who are contracting your core muscles well and effective enough. So hopefully in this video, I can give you some great tips on how to contract those essential core muscles, not only just to heal your diastasis postnatal. It's not just all about diastasis recti. Yes, our programs will heal your diastasis recti, but around about 70% of mums don't have diastasis recti postnatal. And you guys still need to contract with your core muscles post-birth so you can improve your core strength, because it's going to help prevent back pain, prevent pelvic floor muscle issues, and prevent prolapse. Okay, so let's have a little lesson first on your core. I'm going to come up quite close. So your core muscles, we have 4 of them, and I want you to think of them pretty much like an apple core or a canister, okay? Diaphragm at the top, those beautiful pelvic floor muscles which we need so much. We need all of these to help us breathe, by the way, but we need our pelvic floor muscles to function very well. Pelvic floor muscles at the bottom. Transverse abdominals wrap around the front of the core, and your multifidus wrap around the back. Now, your pelvic floor and TA, used to be called TBA, transverse abdominals, are best buddies. Those two contract whilst the other two relax, and whilst your diaphragm and multifidus contract, your TA and pelvic floor muscles relax. Okay, so contracting, relaxing all the time to keep this pressure system evenly balanced and very functional throughout the day. Now, it should be pretty much automatic. I'm certainly not thinking about my core muscles at the moment, but I'm standing up nice and straight. I've had 3 babies. Okay, I exercise 4 or 5 times a week. I don't exercise crazy. I've just had my 40-something birthday, okay? And keeping a strong core has had many benefits over the past so many years of pregnancies, breastfeeding, looking after babies, and the physical demands of motherhood and parenthood. I'm running around after our kids. I'm not wanting to pee myself when I'm running after them on the bikes. Okay. So where are they? These transverse abdominal muscles. Let's talk about how we activate the TA muscles, because these are the hardest. When in pregnancy, everything is stretched. When those muscle fibers are stretched, regardless of the exercise you're doing, and baby's in there, it's really hard for your brain to activate those muscles effectively. And that's why soon after birth, you need to relearn to contract with them very soon after birth. Please watch my video on not waiting 6 weeks to contract your core muscles. Please, please, please watch that video, girls. Okay, so what we're going to do is, I just want you to put your hands just in with your hip bones. Now, if you're pregnant, okay, your bumps here, you're going to have to press down and go in quite far. Okay, so just cough. Or laugh. Okay, make sure, don't pee yourselves when you're pregnant, girls. You shouldn't do. If you do, you really need to come and do our Fit to Birth Mum program. Okay, or follow the No More Mummy Tummy Challenge through your pregnancy. Okay, so it's false to think about. We need to learn to contract those muscles as we exhale through movement. And then once we're standing around, to improve how effective we contract with them postnatal and through our pregnancy. Okay, so the old way used to be draw your belly button back to your spine. That's far too much. And what happens is we create too much intra-abdominal pressure and the upper abdominal spiral. So what happens is, even if you're managing to contract with these your transverse abdominals, they're going to get switched off eventually because these upper abdominals are so much more stronger and used to the working endurance. Okay, these are your endurance muscles. Okay, stabilizing muscles are your little transverse core muscles. Okay, so I'm standing up nice and straight. Nice deep breath in. And then as I exhale, I'm going to think of just pulling my belly button in slightly and drawing up towards my heart. So it's a scoop action. And that should slightly activate my transverse abdominals. Now, it's good if you're not seeing much happen here because that's how subtle it needs to be. All right. So I'll show you again. Come quite close. I'm going to activate. Good. And down. What you can also think about is drawing the two hip bones, your pelvic bones, towards the center and then up. So it's that lift, which can also help. Now, if you put your fingers here, you should just see a slight activation. Okay, so my fingers haven't really raised up. You shouldn't see your fingers push up, and you can see that better when I come onto the floor in a minute. Okay, now also at the same time when we're contracting our transverse abdominals, we need to think about our pelvic floor muscles. So we lift up the pelvic floor muscles, think jellyfish swimming, okay? Lift them up, let them go. Lift them up and let them go. And you should feel a frontal lift from your vagina. It's like picking up a raisin, all right? So I would tell, also, pick up a raisin, stop a tampon from falling out. It's not a tight squeeze, okay? And you don't want to feel your glutes squeeze when you're trying to activate your pelvic floor muscles. If you're feeling your glutes contract, then there's a definite weakness and function that needs improving, okay? We need to go back and really concentrate on just probably pelvic floor muscle lifts and exercises before we add in the TA. So when you're on the floor, girls, I'll keep that down so you can see. Okay, so often we're taught to contract when we're on the floor. So you want to make sure that you're in roughly your position of neutral. So that means you're not pushing your back down too much and tilting your hips underneath you, and you're not in a lumbar lordosis. So you just want to be able to just put your hands underneath your back and keep that nice and relaxed. Now, if you've got any back pain in this position, just pop a towel under your back and that should help. Okay, so when we contract the transverse abdominals on the floor, like I said before, you shouldn't really see, you just see the belly button drop down and your fingers just raise just slightly. So you don't want to see that happen. See, my fingers got pushed off? That's too much. If you put your hands here on your upper abdominal, so anything above the line of your navel shouldn't contract. So if you put your hands here, it should maintain nice and relaxed and soft throughout your breathing. You don't want to see this happen through your breathing. Everything should be nice and relaxed. It's a deep breath in, not much movement. Exhale, contracting pelvic floor, let them go. Trying to keep my rib cage nice and relaxed. You may find that one side is harder to contract than the opposite side. If that's the case, again, focus on the weaker side. My weaker side is the left side. So I try and think about that left TA muscle just a little bit more. Okay, so really, really good to practice these connections and breathing contractions soon after birth and during and throughout your pregnancies to make sure you stay connected and can contract those muscles correctly at a basic level, and when you're standing, until then you can progress onto the movement one without your upper abdominals firing up and you've just got that nice support of your transverse abdominal muscles, okay? So to remember how to activate your core muscles through your pregnancy and postnatal, think like a jellyfish, pick up a raisin, stop your tampon from falling out, scoop, okay, not a pull back. Bones together, scoop up, belly button in slightly, scoop up towards your heart. Really good cues and keys to help you contract with your core muscles. And again, think what works best for you. Okay, we're all a little bit different. And remember, we contract as we exhale and let them go on the inhale. Hopefully you enjoyed today's video. Please comment if you're not sure on how to contract your core muscles. Go to the website pregnancyexercise.co.nz for all your pre and postnatal online programs that you can join at any stage during your pregnancy and postnatal up to 10 years. And then there are also the Fit Mum workouts and challenges. Our No More Mummy Tummy challenge is amazing. Thanks for watching, everybody. Please make sure you subscribe to our YouTube channel and visit the website often. Thanks, guys.